Have you been told that your knee or hip pain is just wear and tear and that there's nothing that can be done for you? Well, that's not the full story. Let's break down what is actually happening inside your joint and understand what osteoarthritis actually is and how we can start making you feel better. Before we can begin understanding what an arthritic joint looks like, we must begin with what a healthy joint looks like. Now, we're talking about osteoarthritis, which is not rheumatoid arthritis. That is an autoimmune disease. So here we have a knee joint, and the normal structures of a joint is we have the bone on either side. So in this case, we have the femur on top of the tibia. We have the joint capsule. So this surrounds the whole joint. So the joint capsule will be all circumferential, circular around the whole joint of the bone here. Inside the joint, we have fluid. Now there's not actually this much space between the joint, but there is fluid in there. The fluid is important to bring nutrients to the different components of the cartilage and keep the joint healthy and fluid, literally. Additionally, we have cartilage, and this is what our big talk is going to be, is cartilage is on the top of the ends of the bones. And the cartilage is what absorbs force. We can think of cartilage like a sponge. So imagine you have a sponge at the end of the bone here. Every time we stand or there's weight through it, the sponge squishes and some of the cells die and the fluid gets squished out. But as soon as we lift the weight off or the bone comes off, like when we lift our leg in a step, the sponge sucks in new fluid and then the cells will regenerate. That's the normal function of cartilage. So normally we have a nice layer of cartilage that absorbs force and sucks in the fluid and then squishes it out. This is a normal process that which will occur. Now, what happens in an arthritic or an osteoarthritic joint over time is that the cartilage will eventually break down. This can happen to a multitude of factors, such as your genetics, consistent weight bearing in the same position over time from that repetitive use, or it can be happening from previous traumas or injuries that compromise the knee joint, such as surgeries like an ACL rupture. When the osteoarthritis starts to impact the joint, it impacts the whole joint. So the cartilage will first start to break down and wear away. What happens when the cartilage goes down, the size shrinks. In the areas where the cartilage is shrinking, there's more force that's going into the bone. So the bone starts to thicken in those areas. Those areas where the bone thickens can cause what's formed as an osteophyte. And that can be pointy, elevated, brittle parts of the bone that will shrink the joint space. So the joint will get smaller and be less space. When this occurs, you can have less joint movement, more stiffness. Now there is inflammation that will set into the joint. It'll impact the joint capsule and all of the surrounding muscles and tendons. And this is where the physio aspect comes in. When osteoarthritis is in a joint, you can't reverse any damage that has been done. So the cartilage that has been worn away has been worn away and you will not regrow more of it. However, what happens is the muscles and tendons become inflamed and very protective and avoidant of movement. This is the exercise that needs to be done to reverse that muscle and tendon inflammation so your muscles will do the right things to keep protecting the joint and building strength there. It's because our body gets avoidant and wants to avoid moving it because it's in pain, but the exercise breaks the cycle, and the exercise is what helps to actually keep pushing the progress forward and maintaining whatever we have left. There has been absolutely zero evidence to support that any exercise or activity leads to increased osteoarthritis. A huge study done in road runners even showed that running did not make arthritis worse. What we want to be mindful of is our biomechanics when we are doing activities such as knee valgus, which can put more stress on the joint. But the exercise or activities itself has no impact and should not be stopped when trying to improve your condition of osteoarthritis. Exercise is critical in osteoarthritis. It's going to improve your function where painful activities will become easier. With this improved function, you'll have better quality of life. What the exercise does is it helps to build the resilience, the strength of the muscles and tendons, and prevents the fear avoidance of our body. It makes us able to protect our joints by increasing the joint lubrication, increasing the joint mobility, and increasing your confidence in it. As the joint gets stronger, it's because the muscles and tendons are helping to protect it. It'll give you more ability to perform more tasks and improve your overall function. Doing strength-based exercises is the first line treatment of managing osteoarthritis and making your function better and preventing further degradation of the joint. It's important to remember that having osteoarthritis does not mean stopping your activities. We actually want to encourage more exercise and specific strengthening to build up the muscles and protect the joint. What damage that has been done to the cartilage cannot be reversed, but you can slow down and potentially stop the progression to make it worse. These things will help us to become better at our daily life and improve our function and quality of life. The next video is going to cover specific exercises, so subscribe to follow for the next one. Thanks for watching. Please like and subscribe and leave a comment below of something that you'd be interested to see next. Tune in next time.